Deputy Brid Smith.
Thank you, Ciaran Corla. Taoiseach, I'd like to ask you, please, to respond to the news that the Psychiatric Nurses Association have voted by a staggering 87% to take strike action over staff shortages in mental health services, and in particular staff shortages in the mental health nurses, the psychiatric nurses. Now, if I could refer to the famous Vision for Change, which dates back to 2006, and under the Vision for Change, it recommended an increase of 1,800 staffing in the mental health services. By 2012, we were 23% below that recommendation. In 2014 alone, and this is just picking out 1 year, the suicide numbers in this country were 475, and that is not to count in the numbers of people who attempted to take their own lives or did themselves harm because of the level of mental health and mental health deprivation that continues in this country. So the reason the PNA are giving for the serious ballot on strike action is because there is absolutely no clear plan from the HSE about how to address this staffing crisis. We're 50% below staffing levels in child mental health services, and 75% of adult mental health services is all that we have completed. And what the PNA are saying, Taoiseach, in case you haven't heard the piece, is that currently there are 600 vacancies for psychiatric nurses, and there will shortly be another 400 within the next year, in fact, because of retirement. That leaves, just to stay up to the level we're at the moment, a requirement of an extra 1,000 nurses in mental health, and that's not including child psychiatrists and other therapists that are required in the service. Now, later on, there's a lot of questions to you about the programme for government, but I want to use this opportunity to ask you what the programme for government intends doing in this regard, since it does, under the mental health section, say that we will implement the Vision for Change. Given this level of crisis in staff shortages, given this level of crisis in funding to mental health services alone, can you please outline for us what answer you will be given to the Psychiatric Nurses Association and to the mental health services generally, and indeed those who require mental health services, to this absolutely chronic shortage in this service? Because it seems to me that the programme for government and the HSE for sure are failing to address this urgent crisis.
Thank you, Deputy Taoiseach.
Well, this is a very important question that you have raised, Deputy Smith, and that's why government, in its decision this morning, have made it clear that the extra allocation to the estimate for the Department of Health and the HSE will restore in full the ring-fenced monies for mental health services, and the details of how that is to be allocated and to be spent will be outlined by Minister McEntee and Minister Harris over the course of the discussions on the estimates next week and the week after. I think it is fair to say that there are some serious recruitment issues in respect of the problem here, and the Minister and the Department are looking at that very question. At least I can stand here and say that because of the increased strength in the economy, that an adjustment is made here to deal with what was set out in the programme and the allocations for the mental health area. But, you know, talking to people just the other day in respect of the Department of Children, I find that there's always the complication between psychologists and psychiatrists working for the HSE and working for THUSLA, where children might need services, and these things have to be contracted again. And then the legal costs that arise in areas surrounding children itself are always very costly. But I would say to you that in respect of the question of suicide and self-harm, these are obviously, very traumatic, sensitive issues that apply not just in any location in the country, but all across the area. There is the clinical programme for the assessment and the management of self-harm in emergency departments does provide a skilled response to people presenting with self-harm or suicidal ideation, as they refer to it, in emergency departments through a network of self-harm psychiatric nurses. 24 of the 35 additional nurses have been recruited to this programme and trained for this role, so they're doing a very important job, as you can aware. So the HSE is committed to further developing early intervention and prevention services, and I do hope that the extra allocation being made to the health area and the restoration of funding for the mental health area will benefit these persons greatly. As I said, Deputy Smith, the details will be outlined by the ministers over the next week or so.
Thank you, Taoiseach.
Taoiseach, I'd just like to point out to you that in the periods that I outlined of the ever-increasing shortages of staffing in mental health, it was also the period of austerity when economic hardship and worries about where to live and losing jobs and putting a roof over your head and sending kids to college, etc., have put a massive stress and strain on people, leading to further loss of mental health in families and among self-employed people and unemployed workers. So that whole period that we have discussed, that I've just looked at in terms of the reduction in psychiatric nurses in particular, is the one that the PNA are focusing on, and it is those figures that they're focusing on, and you have failed to address my question. If the Psychiatric Nurses Union takes strike action on the issue of nurse shortages and the need to recruit at least 375 per year for the next few years, extra psychiatric nurses, where is the money and the determination to come from? You've just answered Deputy Martin on the question of extra funding that has been allocated to health, and you said it will go to existing services, overruns in acute hospitals, disabilities, home helps and mental health. Now there's a lot of stuff to get divvied out there before you even start looking at the need of engaging an extra 1,000 psychiatric nurses, according to what the PNA are taking strike action for.
Thank you. Taoiseach.
Yeah, my apologies for not addressing your question. Obviously, I would hope that industrial action would not take place. The Minister for Health met with the association last Friday and is engaged with them. And some of the issues that are being considered, Deputy Smith, are the possibility of more training places for psychiatric nurses, the possibility of bringing back a number of recently retired psychiatric nurses, and the continued efforts to attract nurses back home to Ireland who have been working abroad. Now, this is a genuinely serious problem, and one which Ministers are obviously working hard to grapple with. In 2015, there were almost 30,000 people offered a first appointment and seen in respect of the vision for change and the mental health strategy that's been there. And as Deputy Smith's aware, Cancora, every emergency department has 24/7 access to mental health services. Consultant psychiatrists and NCHDs in psychiatry working in general adult and old age psychiatry services, together with liaison psychiatry medical staff, provide an on-call service outside normal working hours, and it's largely focused towards people presenting with urgent mental health problems. So government made the decision to adjust the estimate in respect of the health vote. The mental health area is being restored fully. Details will be outlined by the ministers, and I'm quite sure that your own input will be valuable to what is a serious argument.
Thank you very much. We move on. Deputy Michael.